Welcome to Realizing Resilience, a podcast from the Connecticut Women's Consortium. We're not behavioral health professionals, but we're your gateway to real conversations with the experts. Each episode, we'll delve into the vast landscape of mental health, from personal stories to expert insights. Together, we'll bridge the gap between clinical expertise and personal experiences, connecting with diverse voices and perspectives. Join us for insightful conversations that demystify the world of mental health. Dr. Tracey Meyers is a licensed clinical psychologist with expertise in neuropsychological assessment, psychotherapy, including trauma-informed therapies, and positive behavioral planning. In addition, Tracey has extensive training in integrative medicine modalities to support optimal mental health. She is an advanced yoga instructor and yoga therapist. She is certified to teach MBSR, iRest, and breath body mind. She lectures across the country and internationally on different integrative medicine topics for healing. She authored several publications and book chapters around holistic behavioral treatment for mental health conditions. In 2022, she wrote a book called Yin Yoga Therapy in Mental Health, which describes how yoga can be an important part of recovery for many people with mental health and traumatic brain injuries. Tracey is on staff at Lawyers Concerned for Lawyers, a legal assistance program for lawyers, judges, and law students, providing mental health support and well-being coaching. She also works as a neuropsychologist for Synaptic Care, an online teleneurology group providing care for people living with ALS, Parkinson's, Huntington's disease, and dementia. Tracey is a part of the faculty at Maryland University of Integrative Health and the Center for Integrative Yoga Studies. Hello, everyone, and welcome back to Realizing Resilience. I am your host, Marissa.
I'm Alana.
And today we have the pleasure of speaking with Dr. Tracey Meyers. Thank you so much for joining us today so we can talk about some good stuff.
Thanks, Marissa and Alana. Nice to be here with you both.
It's good to have you. I'm ready to talk about some good stuff because I'm always really interested in your trainings. So I'm glad that we get this moment to talk with each other. I know that your background spans clinical psychology and integrative medicine and yoga therapy. So how do these disciplines intersect in your approach to mental health treatment and support?
Yeah, that's a great question. And, as I was thinking back about my career, I was trained in the 1990s, and it was a very traditional time where, most of the psychology training was really from the neck up, right? It was all cognitive behavioral. And so the idea of looking at the body or working with the body was something that psychologists didn't typically do. And so my traditional training was in neuropsychology. So I did assessment and cognitive behavioral therapy. In my own personal life, I became interested in yoga and mindfulness meditation and started sort of what I call like having two lives. Like I would do psychotherapy during the day. And then at night, I started teaching yoga and I ran some mindfulness courses. So I had like these two different worlds. But little by little, they started to creep in. And at my day job, I was working at Connecticut Valley Hospital. People would start to say, hey, do you want to do a yoga class? So I started doing some community yoga classes. And then people were interested in learning mindfulness for the staff. So I started teaching mindfulness to the staff. And then little by little, it started to impact my psychotherapy work too, working with clients. And I got more and more comfortable actually bringing those threads together. And now I can't imagine doing it differently, because it's such a big part of the work I do with individuals and groups, which is really integrating the mind and the body. And so now we know as psychologists and looking at the research that it's not just working with the head, but it's also working with what's happening in the body. So those two separate lives have really melded into one, and it really helps the work I'm doing. And it's much more, rewarding for me as well as a clinician and as a practitioner.
As we move forward as a society and think about behavioral health and how things change, holistic medicine and integrative medicine is becoming a lot more accepted, but there's definitely still some misconceptions and misunderstandings that people have, I think can be resistant to that combination. I know for me, when I started therapy, I was like, I'm not meditating. That's not going to do anything for me. This is a brain problem. And just not realizing that connection between my breath and my body. And when I finally came to accept it, I was like, this is so helpful. I was really ignorant to kind of ignore it. But what are some of those misconceptions or misunderstandings that people might have about the integration of holistic and traditional medicine?
Yeah, it's such a good question and for a lot of us, we have that misconception. I had it too, just didn't have the understanding of how important the body was. The misconceptions about mindfulness and yoga, well, people will sometimes feel like it's religious, like there's a spiritual bent to it. And it does come from, the traditions of mindfulness do come from Eastern contemplative traditions that are 2,500 years or more old. old. And so the roots are there, but it's really been utilized in secular settings, medical settings, and now in psychological therapy and different kinds of settings. So, moving from that idea that this was something you had to go to India to do or somewhere in the Far East, and now we know, no, this can be part of a regular program. In 1979, Jon Kabat-Zinn, who's sort of the founder of Western mindfulness, created the mindfulness-based stress reduction program. And it was really revolutionary because it was the first time that modern medicine started to embrace mindfulness as a practice to help with chronic pain and to help with all sorts of other ailments that we face in terms of stress. And so I think since then, there's become this increasing focus on it can really help with different physical and emotional challenges. I think other misconceptions, I can't do it. Like that's the number one thing I hear from clients. If I ask them, oh, have you ever meditated? They'll say, I can't, my mind wanders too much. It's too hard for me, which is very understandable. And the good news is that we actually all can do it because we all can breathe, and so really helping people realize you don't have to be able to, in the beginning, especially sit and try to meditate for hours at a time. Like that's impossible. But can you begin to integrate mindfulness while you're walking your dog in the morning or while you're taking a shower to feel the water on your body? So we can use senses, we can use breath, we can use sounds. There's so many different ways to help us become more present. And that alone can start to help us feel better. So I think that's one of the myths I really work hard on trying to dispel is that you don't have to be a meditator and you don't have to be good at it. And you can have very, very anxious, active thoughts going on and still get a lot of benefit. And for many of us too, it isn't always a sitting practice. Maybe it's going to be mindful moving. Maybe it'll be yoga or qigong or some kind of walking program, but we can integrate that into a daily lifestyle that actually can make a difference, not only physically, but emotionally. I think the last piece I want to say is the accessibility. For some people, it can feel like, oh, I wouldn't know where to begin, or I don't have anything in my local area. And now, thankfully, I think really post-pandemic, the ability to hop on a yoga class online or have an app like the Calm app or a Headspace where there's just so many accessible programs with a little bit of guidance, you can really find your own practices without having to spend a lot of money or even leave your house. So I think that accessibility piece has really opened the door for many people as well.
Yeah, the religious misconception, I feel like that's a thing I always overlook. And it just reminded me, I used to be a teacher, and in the handbook, at the beginning of every day after the pledge, we would do a minute of silent reflection. And there was this little qualifier in the handbook, like, this is not religious. It's just a moment of silent reflection. And I just don't always think about that implication. But I love what you said about it being a practice and a thing that people aren't inherently good at the beginning. I think it's something where people just assume they can either do it or they can't, and that there's no building up to it.
Yeah, I mean, the truth is our minds are designed to worry, plan ahead, and not be present. It's like a protection, right? So instead of saying, well, that's something wrong with me, it's actually, that's how we're designed. We have this, what we call a negativity bias, where our brains are wired to look for what could go wrong, to plan, worry, and anticipate. And so that seems like, well, then how am I ever going to meditate, right? But if we recognize, oh, we're all wired this way. And in fact, the way to work with that is to help gently and slowly introduce this present moment awareness, which a lot of us, we don't intuitively have because our brains are wired from an evolutionary standpoint to be looking ahead toward what could go wrong. So, I think I like to really normalize that all of us have that tendency to mind wander, to worry, to have difficulty focusing. And it does take time. It just takes a little bit of training and some guidance to be able to use more present moment awareness.
Do you feel like in your sessions with people who say, oh, I can't do this, or are really hesitant or like resistant to take that step, do you think there's that moment when they start to accept it and just kind of clear their head and say, okay, I'll try it? Do you get to see that transition of the openness and how it affects them and how maybe they sit different?
Such a nice question. Definitely. I'm more blatant about it. Like I will actually have people even like rate their stress level before we do a brief practice, just so they can really see for themselves, like on a scale of 1 to 10, how stressed are you right now? And a person may say, I'm at a 7 or 8. And I might ask them, where do you notice that in your body? And maybe someone says, oh, I feel like a little bit of tightness in my chest or my belly. And then we'll do a very short practice, like maybe 2 or 3 minutes of breath awareness or a gentle body scan. And then at the end, I'll ask them again to rate their stress level on a scale of 1 to 10. And often, not always, but often the number goes down, sometimes a couple of notches, sometimes way down. And then I'll have them notice where they feel that in their body or what might have shifted. So they're actually noticing it themselves, because even if I notice, which is great when I do, but it's really important for them to have that direct felt experience and to be able to not only feel it, but then really like verbalize it and feel it in their body. And that can make a big difference in terms of wanting to do it more and feeling the effects.
Yeah, so much, I think not only therapy, but also mindfulness is a lot about just accepting the moment you're currently in. And like you said, that's so hard to do because that's not a survival tactic for us. If I'm not thinking ahead, how am I, your little reptile brain, how are you surviving? So I think that combining the two of them, just two things of having to accept your now and also maybe accept your now in your body and your mind and whatever, is probably a very freeing experience for someone who is resistant to let one of those go or accept one of them.
Yeah, I love what you're saying, because that's one of the instructions sometimes I'll give people, is even just accepting for now. If we have a feeling of distress physically or emotionally, the idea of like just accepting it from now on feels really overwhelming. But if I can accept just for this breath or this moment, it's like this. And then to even bring compassion in, like if it's a difficult feeling, not only accepting it, but saying, oh yeah, this is hard, or oh, I'm struggling. So this idea of naming it, there's this expression in psychology, name it to tame it. And it's this little funny adage, but it's the idea that like when we're actually able to notice and accept for a moment what's happening, our level of distress goes down. And there's research documenting that the part of the brain, the amygdala, that fires when we're distressed, our fight, flight, freeze, threat detector, actually calms down when we name our experience, just the act of naming it. And so that idea of like, when we notice something uncomfortable, we don't push it away. We don't pretend it doesn't exist, but can we bring it to awareness with compassion and just name it? So that's sometimes the beginning of a mindful practice, right? It's just what's happening now, what is it like, and bringing compassion. And that alone can take some of the distress away.
Yeah, absolutely. And it kind of lets give yourself some grace and like
Yeah.
you're allowed to feel what you're feeling
Yeah.
and that's okay.
Right. I love that grace term. It's like if we can let ourselves just actually feel what's here to be felt, right? I have another little pithy saying, none of these are mine, but what we resist persists. What we resist persists. And that's the same idea that like if we push it away, it actually comes back, and sometimes even more intensely, or we turn on ourselves and feel bad about ourselves for feeling that. And so if we can just have the direct experience of the feeling without pushing it away or judging ourselves or criticizing ourselves or blaming ourselves, then often the feeling can soften just by doing that, right? So in the paradox of letting ourselves feel the feeling, it actually helps it to dissipate.
And I feel like that really leads us into that you've got a mindfulness self-compassion series that's coming up at the consortium. Can you kind of tell us what the program is about and what led you to conceptualizing this?
Yeah, thanks for asking about that. So the program is an 8-week program based on the work of two psychologists, Kristen Neff and Christopher Germer. And they're researchers looking at the power of self-compassion. And I think about self-compassion as sort of the mindfulness 102 or 201, however you want to say it, because it has the underpinning of mindfulness. In fact, there are 3 components to self-compassion. The first is mindfulness, being aware of what's happening, which is just what we've been talking about, Marissa and Alana, about this idea of being present with what's happening. If we're not present, we can't even bring compassion in because we're not aware of what's happening. So mindfulness is the beginning. And the second is kindness. It's meeting ourselves with kindness rather than blame. So if we are struggling with something, instead of saying, oh God, Tracey, I can't believe you're doing this again. What's wrong with you? That's my little inner voice. Instead to say, you're having a hard day, Tracey. Me still talking to myself. Like, this is hard. This is a moment of suffering. So that's this turning toward myself versus turning away. And then the third part of self-compassion is recognizing I'm not alone, that Marissa struggles just like me and Alana struggles just like me, that like having anxious or worried thoughts or struggling with depression, like other people feel this just like me. So those 3 components, self-compassion is made up of 3 components: mindfulness, kindness, and common humanity. That really makes up the work of this training. So it's an 8-week training where we do over 27 different kinds of practices, helping us build the skill of self-compassion and then how to use it for ourselves and others. And it's a skill, it's a muscle, just like mindfulness, just like physical exercise, because most of us tend to be a lot more compassionate toward other people. Research says about 80% of us tend to be much more compassionate to other people. But then when you look at ourselves, we tend to not be very compassionate. We tend to be harsh, blame ourselves. We would never talk to our friends and family the way we talk to ourselves, right? And so this 8-week program really helps us to turn toward ourselves with that same generosity and practice over and over again. How do we meet ourselves with more kindness? Now, why is that important at the end of the day? Well, the self-compassion research shows that we actually are more resilient. We actually are more motivated, less depressed, and kinder to other people when we're kinder to ourselves. Earlier, we talked about the myths for mindfulness, right? A lot of myths for self-compassion too, like, oh, if I'm kind to myself, I'm going to let myself off the hook. I'll be lazy, or I don't deserve it. That's self-pity. And, so there's all these kind of myths we have about being kind to ourselves. Got to toughen up, right? But actually the research says, no, it's the opposite. We actually do better when we give ourselves grace, because that gives us the capacity to move forward in adverse situations. So it's a wonderful program, and I'm blessed to be able to run it with Alicia Feller, who's on staff at Women's Consortium, and she is a wonderful clinical social worker who I've worked with over the years. So we'll be co-facilitating. So it's an 8-week program designed to, do both practice and sharing and really working on the self-compassion piece together.
I think framing just compassion is such a good word, because I feel like kindness we really associate with kind of empty nicety, and kindness is really about honesty and accountability. And it's just really important to realize you can both be respectful and kind to yourself without just being narcissistic.
Yeah. And in fact, sometimes compassion is setting fierce boundaries. Sometimes compassion is saying no. So it's not just all soft, that's another myth, is oh, it's all about being soft, but it also can be, I'm going to take care of myself, and this is what I need to do that. So there's both a kind of a tender and a fierce part of compassion, self-compassion, that's really important. And for women especially, we tend to move toward the softer side of compassion. And for many of us, myself included, working on those boundaries and shoring up, and both physically and emotionally, really helping myself to be able to set a limit, set a boundary, is as important as being kind to myself as well.
So you've also got Breath, Body, Mind coming up with us, which is very exciting. Straying a little outside, but not really. I feel like all of your work is, like you mentioned, really integrated. What can participants expect from that training, and how does that relate to your other work?
Over the years, I feel like I have been so blessed to study with fantastic teachers. The thread that connects the different programs, the integrative programs I've done, there's a couple of key things, which are why I particularly am drawn toward them. Number one, there's research to back them. I'm a psychologist at heart. I tend to want to look at the research and make sure what I'm doing isn't too out there, that it actually is grounded in science. So I'm always drawn toward programs that have a strong scientific background and that also help with clinical issues. Those are the two things, both for my professional and personal development. It's does this have background in science, and does it help people alleviate suffering in some way? Does it help with depression or anxiety or trauma? And so if it meets those two categories, then I'm really intrigued. And so Breath, Body, Mind is another one of those programs developed by Dr. Patricia Gerbarg and Dr. Brown. And they created this mind-body program using breath and some gentle movement, including Qigong, to really look at things like depression, anxiety, and trauma. So the program Breath, Body, Mind that I will be doing with my colleague, Linda Lentini, is designed, it's really very experiential, that we really are working with the body over and over again using different practices. And the practices, some of them help calm the nervous system. Some of them help energize and get energy out. And some, like coherent breathing, help us feel balanced. These practices are simple. I'm also drawn toward practices that are accessible. I think when we make something difficult, we're not going to do it. But if something is as simple as learning how to count when we breathe, so coherent breathing, for example, we're breathing in and out to a count of 4. That's all it is, right? We're slowing our breath down to about 5 breaths a minute, breathing in to a count of 4, and breathing out. And something that simple can have a huge shift in our nervous system regulation. It's been proven across the world, people that have survived natural disasters to just regular, daily life. So the BBM curriculum, the Breath, Body, Mind curriculum, is really fantastic. It has just basic, solid practices that are easy to learn and can make a big difference in the nervous system regulation. So Linda and I will be exploring that. Really excited to be doing it in person at Women's Consortium so we can do this experiential time together. And clinicians that are interested in using simple techniques, I think will find it really helpful for the clients they work with.
Yeah, I love how both of these trainings focus on taking care of yourself, obviously for the purpose of doing so, but so that you can continue offering good work and good support to your clients, because it's so true that people in helping professions are often kind of martyring themselves and don't think about the fact that you really need to take care of yourself so that you can kind of continue to offer a high quality standard of care.
Exactly. Like I always think like if I can get clinicians and mental health workers and teachers into the door by saying you can use this with your population, then we can really work on some of the self-care, because it's both. There was a study that happened about 10 years ago where they looked at mental health clinicians that did a little brief mindfulness practice before they saw clients. And they compared it to a group of clinicians that didn't do that centering practice before. It's just like a 5-minute breathing practice. And then they surveyed the patients after the therapy session, and the clients didn't know whether they were working with a therapist that did the practice or not. So they surveyed them. And the ones that had gone to a therapist that did the centering practice before rated the session as more helpful than the ones that didn't. So by doing our own practice, we're more available to the people we're serving, and just being able to be more calm, more balanced, and more present moment focused as a clinician can make a huge difference in terms of the work. Clients, they don't know what we're doing, but they feel it. Of course, they can tell when someone's really present and connected and calm versus distracted or worried themselves. It's like an energetic feeling, when you're talking to someone, right? So I think that another piece of like, it really helps our own clinical work when we have the tools ourselves and we're using them.
Yeah, I imagine it's also helpful thinking about vicarious trauma too and shouldering the burden of other people, because I'm sure as a clinician, I felt this way as a teacher. I would receive information I didn't necessarily want to receive, or, even if I knew that it was part of the job, it still was a kind of a burden for me to carry and to process. So I'm sure that practices like these really help you develop some resiliency.
They do. I think the ability to hold space for somebody, to be grounded in your own body, to be able to self-regulate, like it takes having a practice to do that, because it's so easy. People go into the helping professions, whether it's teaching or mental health, to help people and often have a huge heart and are really compassionate. And it can be very painful. But I find particularly the body-based practices, being able to breathe and regulate your breathing, being able to have compassion for yourself when you are activated, really makes a difference in terms of being able to hold a lot. And so, these practices are sort of the antidote to compassion fatigue and vicarious trauma, because it is a lot of self-care and emotion regulation every time we sit and we bring compassion into our bodies and our breath.
Yeah, and I think that these trainings you're going to be providing, not only the Mindful Self-Compassion series, but also Breath, Body, Mind, are potentially going to change some people's perspective of how they help people. And maybe they might not feel as heavy when they get home or something.
I like to think about, right, like each person we come in contact to after we've done a meditation practice is affected. Our clients, our kiddos, our partners, our dogs. Like when we're even slightly more capacitated and slightly more present-minded, it makes a huge difference. I was thinking about this the other day with my teenager. She was telling me a very long story about school drama and I have so many things to do, right? So there's this part of my brain that's like, oh God, I gotta go do stuff. And then I'm like, no. Like, what is it like to hold space and really listen to your beautiful 15-year-old daughter who is telling you all these things? And so, I brought compassion for myself, the distracted part of myself that really wanted to, and then just like, oh, what a beautiful thing to be able to be here. And so then I could feel the softening, and then I didn't care what I had to do. I was like, I really want to hear about the 15-year-old gossip and drama of high school with my daughter. And if I didn't have that awareness of like both the impatience part of me and also this deep desire to listen and be present for my daughter, it would have been easy to be like, and kind of gotten really busy. So I was able to bring both the truth of those moments in, and that was a direct result of my own practice. So to circle back to your point, Marissa, yes, like I think those moments are precious, have nothing to do with being a good therapist, just being a citizen, a good mom in that moment. And that's the direct result of having a practice.
Well, we are so excited. I'm definitely going to try to sneak out of my office and attend. Thank you so much for joining us today.
Well, thank you both. Your questions were wonderful. And I'm so excited to be in person and virtual and continue to do this work with Women's Consortium. So thank you both.
Yeah, I appreciate the conversation. This was great. And I also feel a little bit more relaxed now than I did at the beginning. I don't know. I know we didn't even do breath stuff, but just hearing about it kind of relaxed me a bit and kept me in the moment, which was nice.
Awesome. Oh, great. Well, thanks again for your great questions.
Thank you so much.
Yeah, thank you so much.
Links will be in the description to learn more about Tracey and her work and keep up with us at the Connecticut Women's Consortium. We'll also link registration for her upcoming trainings, the Mindful Self-Compassion series with Alicia Feller from January 10th to March 6th, and Breath, Body, Mind with Linda Lentini on December 14th and 15th. Tracey also offers an on-demand course, Mindfulness-Based Stress Reduction, which she mentioned in this episode, which will be linked as well. Thank you for joining us today, and we'll see you next time.
Be kind to yourselves.
See ya.